The secret to getting ahead is getting started. Most prominent speaker, Engineer Farooq Ahmad Wani, Superintending Engineer Sher-i-Kashmir, Institute of Medical Science, Srinagar, our mentor, and all the participants. Good evening and welcome you all to SYNAPSIS 21, hosted by the Department of Biomedical Engineering Blaze IEEE EMBS Student Branch Chapter and IEEE Student Branch of TKM Institute of Technology, allied with I- allied with IEEE EMBS Kerala Chapter, Telemedicine Society Kerala Chapter, and Digital Health India Association. Thank you for your continued support, and once again, I humbly invite you all to this auspicious evening. Stepping on to our eighth session of the series, on the final day, we have Engineer Farooq Ahmad Wani to talk on leveraging telemedicine in the healthcare delivery system in Jammu and Kashmir. Moving on to the session formally, I would like to call Ms. Ajina Abdul Kareem to introduce our esteemed speaker.
Thank you, Hannah. Am I audible?
Yes, you're audible, Ajina.
Hi, sir. Good evening, everyone. It's my pleasure to introduce to you this immense profile, Mr. Farooq Wani. Engineer Farooq Ahmad Wani is currently working as a superintending engineer in Electronics and Communication Information Technology at Sher-i-Kashmir Institute of Medical Sciences, Sara, Srinagar, and State Nodal Officer for Telemedicine, Jammu and Kashmir. Mr. Wani holds his Bachelor of Engineering in Electronics and Communication from NIT Srinagar and MTech in Electronics Engineering with a specialization in Communication and Information System from Aligarh Muslim University. After completing his post-graduation in 2002, he joined Sher-i-Kashmir Institute of Medical Science, where he explored his career. He was nominated as a state-level nodal officer by Jammu and Kashmir government in 2005. Telemedicine facility of the state, headed by him, connects 12 district hospitals and primary health centers in Jammu and Kashmir with the state-level hospitals like SKIMS, GMC Srinagar, and GMC Jammu. And it was inaugurated by His Excellency, then President of India, Dr. APJ Abdul Kollam. Mr. Wani coordinated the setting up of LAN in SKIMS, Sara, Srinagar, and Medical College Hospital, Bamina, Srinagar, with 650 and 150 nodes respectively, and computerizing the day-to-day records and activities of the hospital and Sher-i-Kashmir Institute of Medical Sciences. He conceived and planned a foolproof surveillance and security system for SKIMS on the pattern of AIMS, New Delhi. It is a great pleasure of mine to welcome such a noted personality as a guest speaker of the day. So on behalf of the TKM Institute of Technology and all of you present here, let me extend a warmest welcome to you, sir, and over to your session. So please.
Am I audible?
Yes, sir, you're audible.
Good evening, everybody. I am Farooq Wani from Sher-i-Kashmir Institute of Medical Sciences. I am State Nodal Officer Telemedicine Jammu and Kashmir, as I have been introduced by the anchor. I am highly thankful to the organizers of the Biomedical Engineering Department of the Institute who have invited me for this talk. I am also thankful to Mr. Bijoy, who has roped me into this affair, IEEE Kerala Annual Congress affair, SYNAPSIS 21, and has invited me for this talk. I am thankful to him also. So I hope that today's talk will be very beneficial to you and to all the people who are the participants in this SYNAPSIS 21, this session. I will start my presentation. I am just sharing my presentation on the screen. Is it visible to all the participants? Is my screen visible to the participants?
Yes, sir.
Am I audible to you?
Yes, sir.
Yes.
Yes, sir, it's visible.
My topic is leveraging ICT telemedicine in healthcare delivery system of Jammu and Kashmir.
Yes, sir, you're audible.
Okay. Okay. You know, India has a current population of 1.25 billion, and by 2050, the expected population would be 1.6 billion. There is one question. Is the present health infrastructure optimal? Is the performance of that health structure that is available to this 1.25 billion population optimal? The answer is big no, because it is suboptimal and because of an increased burden of factors like political instability, underdevelopment, weak institutions, scarcity of resources, inadequately developed social sectors, and evident social inequalities. One more question arises: is it possible to make the performance of the health sector optimal by 2050? The answer is big yes. That is possible because of the technology that is emerging, and I'm going to emphasize on this parameter in this talk. So how far the political instability is becoming a big factor, a big burden for making the health sector as suboptimal. You know, in every decision making, the political will is very important. The political leaders who are heading the nation's institutions and other policy planning, they have to make health as a priority. We need to invest a very good percentage of the GDP on our health. That is only possible to make the health infrastructure ready for the population to the standards and to the level of care which the people of India want from their government. It's not only in India, but abroad also, because the political instabilities, the systems are not getting created. There are various reasons why the political will is not there, or making health a priority, or making a lot of investment towards the health sector, health structure developments, because there are problems like underdevelopment around. There is a slogan like Roti, Kapra and Makan, and there is no emphasis on the health. The basic needs are to be addressed. And the nations like India have to address these things first. That is where the political leaders become submerged with the current problems than the problem they need to think of about the welfare and the health of the people. The underdevelopment is coherently submerged with the decisions of the political will of the nation. Then there are the weak institutions. Institutions are weak because they are unable to make out a decision which is going towards making proper investment towards health, building institutions and the structures for a better healthcare delivery system in the country, giving highest standard of health to its citizens, making a very good amount of the GDP as an investment towards the healthcare of the citizens. There are definitely scarcity of the resources. There is a shortage of manpower. With respect to the doctors, there is shortage of the manpower in respect of nurses. There is shortage of staff in respect to the technologists or running the machines. There are shortages in respect of various other resources that are required for building a robust healthcare structure delivery system in the country. And then there are inadequately developed social sectors, because we have to address this inadequacy that is there within our social structures. Our priority is being taken up by those things, and health does not take the lead. It does not come to the first in the queue. The other inequalities surpass the health priority. That is why our institutions become weak. That is why our political instabilities are there. That is why the institutions have to make the decision for a very good health structure of the country are becoming weak. So there are evident social inequalities as well. You know that increase in population and building and healthcare service resources will not increase with this in the same proportion. As I enumerated various reasons behind that, there are big geographical disparities in the health and the well-being of the population, along with the demographic and epidemiological transitions that take place. Here, technology has a big role. This gap can be filled by the technology. Technology can make us build those expected health infrastructures within the limited resources that we have. Technology has a role. Technology can play a role to the low-cost innovations. Technology can play a role to low-priced mobile phones and more inclusive solutions that will fill these crucial gaps in the health information and access. The process of healthcare planning needs to evolve by the use of the ICT in healthcare delivery and distribution and public health decision making at every level. This will ensure the delivery of the right health services to the right people at the right place as well as on the right time. See, ICT in health structure can influence the health as well as the education of the people. The intervention of the ICT in health in the form of the telemedicine, telehealth, mobile health, electronic medical record, and other aspects can bring about big changes in the healthcare delivery of the system. And introduction of the ICT, similarly in the education part of it, will bring skills to the people who are serving the people in the rural area. They can be got at par with the people who are working in the primary institutions, tertiary care health centers in the urban areas. We can bridge the gap through the ICT. We can put them at par with each other in respect of the knowledge that they have. The sheer experiences at the tertiary care health centers can be shared with the rural doctors through the ICT platform so that they are well versed with the technologies, with the changes that are happening in the healthcare delivery system. And then they can impart their services, they can deliver their services to people living in the rural area. Similarly, development of the hospital management system in the tertiary care as well as the rural care can make it as a success story for sharing of the resources, for sharing of the knowledge, for the better care of the patients, both in the rural as well as the urban areas under one scale. Similarly, there will be developments in the health research, and we can think of a health data management system. I will elaborate all of them like this. The use of ICT in health and education. As I said, ICT can play a big role in the form of the telemedicine activities. In this digital era, people can easily seek, access, learn, and communicate with others within a quick span of time. This makes education equally accessible, available, and open to all. Health education creates awareness among the public about the communicable diseases, health status, prevention measures, and various current diagnostic and therapeutic procedures. This gives a freedom to the people to choose the best hospitals and doctors to approach for the treatment to have their life in a healthy way. The use of ICT in hospital management system. ICT helps the hospital management to lead the organization in a successful way. This helps the management to overcome the challenges faced by the hospital. ICT helps the management to improve the patient safety and the satisfaction, get updated to the latest technology, have a knowledge on population health and statistics, and keep a note on the government mandate on track. This is what I want to elaborate further like this, that once the data is available to us on how many number of the patients on a particular setup disease pattern are visiting the hospital, then that feedback and input can give an idea to the government. Yes? Am I audible? Am I audible?
Yes, sir, you might continue.
Okay. That can help the governments and the policy makers and the planners to design the hospital delivery system in that pattern and fashion, which is exclusively syncing with the needs of the people who are visiting that hospital. Primarily, the workforce can be strengthened. The use of ICT in health search, this is something which can lead us to the clinical data repository. If the health data is available to us, this can be of immense help to the students who are pursuing their DM, MCH, or MD, MS degrees, and then they can concentrate and do a research or postgraduate research in the areas in the community leading to the community-based healthcare delivery system, or an evidence-based healthcare delivery system, which is applicable to the particular set of population which is living in a particular area, because in healthcare domain there are community-based diseases as well. They can do a research on that, and then they can see the incidence of the disease happening in a particular area, and then they can emphasize on that, do a lot of research in that area, and come up with the solutions so that that local population, that community-based healthcare delivery system is in place. So clinical data repository is something which can come across the country, and then the sharing of the data across the repositories can be of immense help to the research scholars, to the students, to the other people working in the research part of it. ICT in healthcare research helps in finding the possible prevention measures to eradicate and reduce the spread of disease. You can find new technology in diagnosis, which reduces the time and cost. This saves the lives of many individuals by providing treatment in advance. Through ICT, the traditional healthcare system can be eliminated and a new model can be formed for effective quality care. Here is something which we can think of devising the clinical decision support systems for a particular area. Here is something which we can come up with the Internet of Things and all that in that particular area. That's the future of the ICT in the healthcare delivery system coming up as the clinical data repository system. Finally, the use of ICT in health and data management and health information exchange. We can have a health information exchange for the whole country, wherein we can have different sub-modules access spread across the length and breadth of the country, and then those health information exchanges can tell us something about the spread of the disease, the pattern of the disease in a particular area, then the treatment plans, then the management part of it, and then the research part of it. All these things can be synergized together, integrated together to give a robust healthcare delivery system to the whole country. Information communication technology offers various ways to improve the healthcare system. The healthcare field has to use ICT more intelligently to bring in more change and elevate the healthcare to a much higher level, which is important for the country's development. ICT initiatives in J&K hospitals. In Jammu and Kashmir, we have taken certain ICT initiatives in the healthcare delivery system. We have a fully integrated hospital information management system at Sher-i-Kashmir Institute of Medical Sciences, where I am working as a superintending engineer for the last 20 years. Me and Bijoy has started telemedicine long back in 2002 when ISRO started with this program. So with these initiatives, we have been able to escalate, we have been able to expand the services, these ICT services to the other hospitals as well, which has emerged as a success story during the pandemics, due to the COVID pandemic. The hospital management information system in Sikkim has been developed in-house. I could develop a hospital management information system which has different type of modules, and each module is for inpatient management, admission, discharge, transfer. There's a module for OPD management, there's a module for nursing station, there's a module for radiology, there's a module for blood bank, pharmacy, sporto services, and there's a back office. Similarly, we have the modules for the operation theaters, the material management, for the engineering in the hospital, of the whole engineering modules, and all lab management system, stores management system, inventory management system, the security management information system, and there's the management information system which is of immense help to the administration for planning the hospital nicely. This gives them an idea how to plan for the future, how to plan for tomorrow. So a robust hospital management information system like we have developed in any hospital gives an idea how to evolve with the solutions for tomorrow while making a proper and a robust and an exhaustive study of the present and the past. We do have an online patient reporting management system. This has lessened the burden of unnecessary visits of the patient for just collecting a report. This small initiative has given us a lot of relief to the people belonging to the management of the hospital. Similarly, there are online appointments and online registration systems. Again, it has given a lot of relief to the management. The hospital footfall has fallen down. Many people are not visiting the hospital just for making an appointment or just getting an registration done. Similarly, the telemedicine can be thought of. That has given us tremendous help. We have been able to take care of the people who are far off from our hospital, who cannot make it to the hospital every now and then. You know that advantage of the telemedicine, the resource utilization is the first advantage of it. You can properly utilize the service of a doctor. You can provide the tertiary care health tertiary care services where patient at his source or at his home. There can be early intervention of the diseases because somebody gets connected to a super specialist in our hospital through the use of the telemedicine, can get his or her disease diagnosed very much early. Otherwise, he lands up in the hospital when the problem has become very grave. Let's talk of the cancer. There are various cancers which can be detected very early. But being residents of the rural areas, they never find it that they visit the hospital the tertiary care hospital very early and then they get detected and then get diagnosed. Telemedicine has provided the solution. The mobile vans go to the rural areas and then they examine the patients. sometimes they find that there's something which may crop up as a malignancy in the future, or which is in the infancy of it as a malignancy, can be treated now. Will not be treated if kept like that for say months together or the years together. So early intervention is the best advantage of the telemedicine. Similarly, there's this avoids unnecessary transportation. Then there's a community-based care, which was just telling you about. The medical education research will improve the people, the rural doctors who are handling the 80% of our population with respect to the health, become abreast with the knowledge, the current knowledge in the current procedures that are happening. I will give you an example of there was one road or one district in the Jammu and Kashmir, the Dosa district, which was connected to a narrow road. There were more often happening the road accidents. And then those patients would land up in the tertiary hospital in a very devastated conditions. And the time of the travel from that district to a tertiary hospital would have been more than 2 hours, 3 hours, 4 hours time. We once organized one program through the telemedicine to impart training to the people who are working in the local hospitals there on the head injury management. You'll be amazed to note that it has brought down the mortality because they could be managed by those doctors who attend them there in that district. They were provided the tools and technology. They were provided the tips and skills by the tertiary care hospital, the telemedicine, well in time. Similarly, the improved patient documentation, and there's value-based care and the population management incentives, the patient access and workforce limitations. These are some of the advantages of telemedicine that we have had during these 20 years of service in the telemedicine. Now we have reached a level that an increasing number of the conditions can now be handled remotely. There is no need to refer the patients from the peripheral hospitals to the tertiary care level centers for the minor problems. Those problems can be handled remotely under the supervision of the super specialists working in the urban areas in the tertiary care hospitals. And this gives a lot of satisfaction to the patients at their doorsteps. To a super specialist, and their treatment is under his guidance. These are certain areas which I have enumerated, which can be handled in the remotely through the use of the telemedicine. The abdominal pain, campus, abscess, I have listed them in alphabetical order. Blood pressure issues, bronchitis, and then the cough and the diarrhea, and similarly some other disease, addiction and all that. In J&K, we started the telemedicine in the year 2000, when the first telemedicine center was inaugurated at Sher-i-Kashmir Institute of Medical Sciences. The telemedicine facility was started by ISRO on the recommendation of the Standing Committee of the Parliament, and then the 11 more nodes were added to it, which include Government Medical College, Srinagar, Jammu, and then there were some district hospitals, Doda, District Hospital, Thoda, Kutwa, Kupwara, Poonch, Leh, Kargil, and sub-district hospitals Zanskar, Uri, and Thandar. Sikkim is being the only super specialty care in the state of the Jammu and Kashmir, and having a well-established IT platform, including line per 500 nodes, was selected as the hub for this whole project. These are the nodes which we had started from 2002 to 4 at Sher-i-Kashmir Institute of Medical Science, and then 2 medical colleges, and 2004 to 2006 at other district hospitals. This is the pictorial view of a telemedicine network Jammu and Kashmir. Why Sikkim is as a hub for this project? Because we had specialty care of cardiology, urology, nephrology, and other gastroenterology, endocrinology, all the specialties only available at Sikkims. We had advanced Center for genetics only available at 6 Sikkims. Then there was other centers which were available at Sikkim only, but we wanted to extend this facility to the rural areas, and telemedicine became a blessing for us. We could get them connected through the use of this telemedicine activity and provide them that super specialty care at the district hospitals. I will give some parameters that how healthcare delivery system expands, how the requirement expands over the years. I will talk about my hospital. See, the outpatient attendance, which was 2.15 lakhs in 1985, has risen to 5.32 lakhs in 2009 and to 10.8 lakhs in 2018. Similarly, hospital admissions, which were 9.87 thousand in 1985, has risen to 40,000 in 2009 and 69,000.9 thousand in the year 2018. Accident emergency 10,000, which was in 1985, has risen to 60,000, almost 60,000 in 2009 and 1.57 lakhs in 2018. The surgeries were conducted in 1985, 2004, and 63 has risen to 8,209 in 2009 and 12,000 in 2018. So this is the demand that is increasing. Demand is ever increasing. We have to prepare our healthcare delivery system with the ever increasing demand. So telemedicine and ICT can play a big role there. I need to tell you something about that, how telemedicine was very helpful to us in the disaster management. You know that in 2005, there was an earthquake of 7.2 on Richter scale, shared by both sides of the Kashmir, one on this side and the other side, which was in Pakistan. But we were directed by the ISRO to provide 2 locations for Uri and Tangdar on a wafting basis, which our center did in collaboration with ISRO. In fact, the whole equipment, setup equipment was brought by the ISRO. And I will share that experience with you, that how helpful and beneficial it was to the people living in that area when everything had gone on a deadlock. Nothing was working. We immediately rushed to place Uri and Tangdar, got the 2 systems installed and connected to our Sher-i-Kashmir Institute of Medical Sciences. These 2 centers emerged not only as a healthcare delivery centers, but also as the administrative units, where from the decisions would be taken how the relief is to be given to the people who are hit with this earthquake. During earthquake management, many patients in these areas were managed by the local medicos in consultation with special set schemes through telemedicine. I will talk of a fun boy of 10-year-old who had lost his parents and all others in the disaster, was shifted to Sikkim for treatment, and all NGOs concerned about him and actively in the disaster management were updated about his health through the telemedicine. This is Dr. APJ Abdul Kollam inaugurating that center at Uri. This is the picture of the former Chief Minister of Jammu and Kashmir, Mr. Ghulam Nabi Azad, and his deputy visiting that 10-year-old boy at our Sher-i-Kashmir Institute of Medical Sciences.
This, the political will that I was telling, that Azad Sahab had a political will to expand this telemedicine to all the 500 CHC and PHCs in the state of Jammu and Kashmir, for which I had drafted a proposal and which was submitted to the government. Had that proposal been agreed to by the political will during the pandemics, perhaps Jammu and Kashmir would have been the only union territory or the state in the India where a robust referral system would have been placed during pandemic. Here is Dr. Mr. Abdul Kalam Azad, the former Chief Minister, interacting with the lay center. Recently, Sikkim is connected and added 2 more locations, Siachen Base Camp and Namanat Base Camp, in addition to the creation of the telemedicine center Kuris. These are the Jawans at the Siachen, connected to schemes for the patient management. This is at the Nunan Base Camp, the Amarnath Yatra going on, and in one of the base camps, the telemedicine facility has been provided, which is connected to our set of doctors for providing the teleconsultation. During COVID-19 pandemic, telemedicine facility at our center and other centers in the state has been of immense help to the people of the Jammu and Kashmir. Those people who are on a regular management of cancer or all other non-COVID diseases were managed by our doctors through the telemedicine facility. Not only the COVID, but non-COVID patients were very well taken in the sub-district and district hospitals, which had the facility of the telemedicine and got connected to the schemes and were provided the care, the treatment, in consultation with the doctors who are there around them in those district hospitals. They need not come to the hospital for a regular checkup and for a regular treatment or whatever. We started with the telephonic OPD during the pandemic. We started giving people the consultation on the telephone, for which we published various telephone numbers for the informative general public would call us, get consultation of a particular doctor, and then follow them up. Again on the phone, this was followed by the virtual clinics, wherein the whole patient data would come to that doctor and that he would analyze everything and see and ensure that the treatment does not have any compromise at any point of time, keeping the lockdown around and the barriers around in mind. This is the list of the telephone numbers that were provided to the people for teleconsultation. And very recent, during the current second wave also, this was the COVID clinic and the virtual clinic were running parallelly. The virtual clinics were providing teleconsultation to people in the rural as well as the urban areas on a phone call basis. And the management was for both COVID as well as non-COVID patients. Because we could not forget, we could not afford to forget the patients who are with the non-COVID diseases and registered with us. We had to be in connection with them. Those patients needed our consultation. Those patients had to be with us. So we managed this through the use of ICT. We have a plan of extending our telemedicine infrastructure for future. As it was introduced, we have already submitted proposal to the government of Jammu Kashmir as well as India for connecting all the PHCs, CHCs under one ICT platform, so that we know where is the patient, with what ailment is there, and who is attending them, what is the plan of treatment, and do we need to tell some other people in the group to handle them. So multiple specialists looking for working on a single patient, one to many, is the theory behind it. Telemedicine and virtual meetings became the critical link between all the stakeholders in tackling the pandemic. During the pandemic, there are operational changes at multiple levels, and there's an urgent need to find the right solution for a contactless healthcare delivery system. Sikim's administration with ICMR, NDC, and COVIX, apex level advisory groups, departments provide web facility for the virtual courts and various interviews conducted at schemes. We do not stop there. We use ICT for the administrative businesses as well, as is written that the interviews are conducted virtually. The examinations of the students pursuing their MS, MD, DMM, MSH course, or the lab courses, or the BSc nursing or the paramedical courses, they were all conducted online. Challenges and solutions are there. Sometimes the system does not function well in respect of the data connect with the transfer. And most of the other hospitals, the JNK, prefer to get connected to the scheme. And these are the operational issues that, which are coming across, but these are the minor challenges that can be overcome. The system needs operation by a dedicated, skilled, computer-knowing person. We need to have a change management. We need to give the best change management program to our staff in all the hospitals, so that simultaneously they become tech-savvy. When they are, if they are the nurses, if they are the technologists and the technicians and all that, they are to be kept abreast with the ICT revolution that is happening around them. And once they become abreast with that, they will become our strongest workforce to deliver the remote, deliver the care to the remote, to the people living in the remotest area of the country. There are definitely the problem, lack of interest from doctors due to the transitory reason. You know that the doctors do not want to give their expert advice just on a phone call and all that. But these small things will be dampened down over a period of time. They will come down. Or sometimes there's the impression with the people that perhaps their authority is taken if they give something which is specialty with them, which is best with them. They would give it just on a simple phone call, or they will share it with somebody just on an interactive meeting like the Zoom. So might be there that that's lost. So these small things are there, but that's happening in the e-governance activities. All stakeholders need to be trained and get involved in the successful implementation of the telemedicine. Human resource development lead to the ICT is a vast area that is critical to the successful application of ICT in the sector. Skills in information system design and implementation are critical to the successful application of ICT in the sector. We need to build on our own local skills and infrastructure based on the local demand. We should ensure that e-health becomes an integral part of the health organization. We need to build competencies for e-health, find and train skilled people for this. The solution is to create an e-health vision and a strategy designed for the broader and the ongoing consultation. Identify targeted investment in the key initiative areas, develop funding strategies to support e-health initiatives, develop a governance framework to coordinate and integrate e-health strategies, create an e-health office that will ensure coordination, integration, and monitor delivery of all e-health initiatives. It is high time that digitalization, cloud solutions, and analytics technology are leveraged in the healthcare setting. Digitally connected process enable paperless operations. The COVID era calls for perception shift of viewing IT as an enabler to healthcare delivery. I think all of us have realized this thing, that it is an enabler. IT is an enabler in healthcare delivery system. future of Sikkim's telemedicine and the telehealth policy is that we won't get connected to all patients. We won't give our service to every individual. We want to empower our people with the tools and technologies. We want to make better utilization of resources. The leveraging card is that increasing acceptance of telehealth as a trend in standard of care. The international collaborations, the peer sharing instead of the hub sharing. As I was telling that it was made a hub, we now believe in peer sharing. We now believe in mobile health. We now believe in virtual medical centers, virtual clinics, new remote clinical services. There was a concept long back. 11,000 community information centers were spread across India. The objective behind that project was that we should give the telemedicine facility to all the people in those centers. But CIC centers have been established, but this activity has not taken up. But now the present COVID pandemic has perhaps changed the mindset of the people, and then we are ready with that thing that we should make it as an activity in the community information centers. Wellness centers have come up, and these wellness centers can be equipped with the facility of the telemedicine, so that the patients can be given a choice to talk to their doctor who's seeing his problem, his or her problems. And future being the Internet of Things devices and the outnumbered mobile devices in future, telemedicine will become a standard service offered across all care settings. Patients will choose providers, health systems, and hospitals. Medical facilities that embrace telemedicine will see businesses and revenue growth. Telemedicine will become an efficient option for preventive care. We believe in the teleconsultation to telemonitoring to telesurgery if possible. Thank you all. Am I audible? Lucy?
Yes, sir, you're audible.
So any question answers?
Thank you for the session, sir. Now, with your permission, moving on to the question answer session.
Okay.
Participants, if you have any questions, you can put up on the chat box. Sir, we have a question from Amina. In the current situation, how effective is the grip of telemedicine in the healthcare delivery system in Jammu and Kashmir?
As I said, am I audible? Yeah.
Yes, sir, you're audible.
As I said, it has been of tremendous help to us. We have the telemedicine facility at schemes and 12 more centers across the state. We could make use of this telemedicine facility during this COVID pandemic. It will be interesting to note that when there was flood in 2014, there was a communication deadlock, complete communication deadlock. It was only the telemedicine at Sikkim that worked. We hooked up with Space Application Center Ahmedabad and got our messages telecast through that to the whole public who were inundated with the flood. So it is not something that we are providing through the telemedicine, the healthcare only, but also many a times it is being used for the administrative as well as for all other purposes as well. Because in Jammu and Kashmir, many times there are because of some reasons around, the internet has to be put off, and then how to get connected to our public is perhaps through the telemedicine. The local administrators make use of the telemedicine centers for getting connected with the people who are otherwise getting disconnected because of the internet lockdowns. But during COVID pandemics, I can tell you, it has been of immense help to the people who were on the cancer management and had to be there with us during, had there not been this pandemic. They were on a follow-up in medical oncology, surgical oncology, or on some radiotherapy or some other treatment purpose. But once there was the lockdown, they got held up at their homes. To manage them was a difficulty with us. We immediately identified them, got them to the respective district hospital, and managed them. Our super specialists would provide all support, help, and knowledge, and the treatment protocols to the people who are attending them in their district hospitals. So it has been of immense help to us.
Thank you, sir. We have another question from Gopika. What role can be played by the youth in popularizing telemedicine?
Youth are our heroes. Youth are the people who have to take it on their shoulders and move it forward. We have started, as Bujay was telling in his presentation, we started with 256 Mbps, 256 kbps rather. Then nowadays it is 1G network available to all the hospitals in the country, and then there is BharatNet. Every nook and corner in the panchayats have been connected through 1G network. So bandwidth is not a problem now. The only problem is the motivation, the awareness among the public, to see that there is definitely a requirement of the touch by a doctor to the patient. But follow-ups can be just minimized by use of the telemedicine. And this is the younger generation who can popularize among the general masses, who can understand the people, the doctor, these masses, that their care is available, their specialty care can be available to the use of ICT at our doorsteps. Whatever facility they want to have. I will give a small example. For example, whenever somebody gets diagnosed for a cancer in our Sher-i-Kashmir Institute of Medical Science, definitely he thinks of visiting Tata Memorial Hospital. So traveling to the Tata Memorial Hospital and then seeing the doctors there and then showing them what has been done to me, or what is being prescribed by the medicos at the Sher-i-Kashmir Institute of Medical Science. Then landing back to his state of Jammu and Kashmir, coming up with this, that they said that it's all okay. It is better that what we are doing, that we get him connected to the, if he wants, we get him connected to the Tata Memorial Hospital, and they see that this protocol of the illness is as per the standard. The same would be done here, or this is small change that you have to make in your protocol to deal with this patient. So that patient has a satisfaction that he's being treated not only by the doctors at SYNAPSIS, but by the doctors at Tata Memorial Hospital as well, without traveling to that place. So that is of immense help to that patient. He has a satisfaction with him that he is being seen by all the oncologists, both at SYNAPSIS as well as Tata Memorial Hospital. So earlier days, when this facility was not there, he would definitely visit that place and come up back to us after 10 days, 20 days, when he would reach back to state that they have said that the treatment protocol is okay. So this makes a lot of difference to that patient. Similarly, when there is somebody who is being seen by a doctor in some district hospital, and he has a satisfaction level with that doctor, and he wants to move to the tertiary care or seeking the second medical opinion. If that opinion is given to him by that doctor through the use of the technology, it is immediate that whether he visits him or not. Probably visiting to that second opinion is not required at all. It saves the time of the doctor, it saves the time of the patient, it reduces the cost of the travel, it reduces everything, and then everything while working, he can take care of this health. This is the patient doctor perspective. Now coming to the continuous medical education problem of the medical professionals. Those who are working in the rural areas, they definitely need to be updated and kept updated with the newer technologies that happen in the medical world. So conducting CME through the use of the telemedicine is itself, because that's one of the activities that has been envisaged while this program was designed. Keeping them updated with the latest developments and technologies is beneficial to the people who are living in that rural areas, because they can deploy that technology, that level of care that they can deploy there only. And even during the patient management, if they have some sort of doubt, they want to refer it to the super specialist. Just get him connected, get the opinion without wasting the time of the travel, without just putting that patient in a queue and go asking him for a referral. So all these things, they are ultimately benefiting the patient and ultimately making better utilization of their resources, which includes the doctors as a special level or the doctors at the primary level.
Thank you, sir. We have a last question from Sharon. What are the difficulties faced while implementing telemedicine in extreme weather and difficult terrain conditions?
Yeah, in weather conditions, I will tell you one thing, that VSAT is a technology which is weather irrelevant. VSAT, when we had at all the 12 locations, it is connected through the ISRO satellite VSAT, very small aperture terminal. Though the bandwidth has been provided by the ISRO, it is satellite-based system. No problem with the weather. Yes. Again, the other modes of the connectivity will be through this through the bandwidth that is being provided by the, say, BSNL or any other operator. That is again through the fiber. But nowadays, these are not the problems. It's not the earlier day that you are getting the internet with the copper wire and then small rainfall and this would disturb that everything. It's not, these are the problems not coming up as well. But it's not not now a problem in getting connected the patient and the doctor through in the telemedicine. And through the terrains, yes, getting connected that in the highest. You see, the population of Jammu and Kashmir is scattered. You will be, if somebody has visited Kashmir, there will be houses which are on the top of hills. Getting them connected is a difficulty. But once the connectivity is established, then connecting physically and operationally for the patient care is not a problem. Providing the facility is a problem, but that is one time thing. But through the BharatNet, every nook and corner of this Jammu and Kashmir has been connected. 1G network is available in all the panchayat ghars. The CIC project that I was telling, it is available almost in every village. In almost every village of this state, wherein 1G network is available. So connectivity is not a problem. Connection is already there. The only thing is that the youths have to mobilize the masses, that there is a technology available. ICT has immersed in, has got penetrated into the healthcare delivery system. Now the things which were not available to them or were getting available to them earlier by getting the appointments and all that, it is not all finished. We can get appointment through ICT networks and then get the treatment plan or the patient care management through the use of the ICT only.
Thank you so much for replying to all the doubts, sir. It would be great if someone could give a feedback for this session.
Good evening, one and all. I am Fatima Fatahuddin and I'm a second year biomedical student. Sir, I would better begin with a big thank you for being with us today and sharing the limitless possibilities of telemedicine. It was such an informative session. The session has definitely aided us to get on par with the prevailing progression of telemedicine in healthcare delivery system in Jammu and Kashmir. You gave us different information about ICT in healthcare, education, use of ICT in hospital management, health research, health data management, advantages of telemedicine. Moreover, you gave all answers to our queries. Thank you, sir. Thank you so much for this wonderful session.
Thank you all. Thank you.
Thank you, Fatima. I kindly request all the participants to fill the feedback form given in the chat box. Now, I would like to call Arif Mohammed to deliver the vote of thanks.
Good evening, everyone. I am Arif Mohammed, third year biomedical student of TKMIT Institute of Technology. I'm glad to have the opportunity to express my gratitude on behalf of SYNAPSIS 21 to every one of you present here, without whom this event would have been nothing. We are extremely grateful and happy to see our 150 active participation on the final day of our event. It's my huge privilege to thank our respected guest of honor, Mr. Farooq Ahmad Wani, who honored this event with his presence and spared time from his busy schedule by sharing informative sessions with us. With this session, we understood a lot about use of telemedicine in healthcare delivery system in Jammu and Kashmir. Thank you, sir, for giving insightful time and clearing all our doubts in this limited time. Every one of us is very much grateful to you, sir. Now, as an expression of delight and respect, we would like to present you a virtual moment from our side. We request you kindly accept it, sir. Shall we have the presentation?
Thank you, sir. Thank you. Thank you very much.
Thank you, sir. Now, let me take time in thanking each and everyone who stood beside us from very beginning to this day. Thank you, Ajina Abdul Karim, for giving us a great introduction of our chief guest of the session. I extend my heartfelt gratitude to IEEE EMBS SBC, IEEE Students Branch, and Blaze Organization of TKMIT, and collaborators Telemedicine Society of India and Digital Health India Association, who are the backbone of this colloquy. Let me also take this opportunity to thank IEEE Kerala section, Mr. Allen, the section ECC for extending this immense support. Thank you, Ms. Saina Fida, for keeping up an outstanding converting throughout the session, and thank you, Ms. Fatima Fatahuddin, and every others for sharing your feedback on the session. I also thank you, Principal, every head of departments, and our teachers for their constant support, advices, and participation throughout the event. Last but not the least, I conclude by thanking all the delegates for our enthusiastic participation and raising your courage. Thank you so much for your cooperation. Once again, heartily gratitude to every one of you. Thank you.
Thank you, Arif. Once again, thank you, sir, for giving us such an informative session. It was a pleasure having you with us. We look forward for listening to your sessions in the days to come. Thank you all for attending this session and for your valuable time and cooperation. Kindly fill the feedback form before you leave. We will be joining shortly with Dr. Murthy Remilla for the final session on the topic Evolution and Growth of Telemedicine in India. Until then, bye from Team Synapsis. Stay tuned or join back in the same link by 7:20 p.m. This is Zainab Fida signing off.
Thank you.
We will begin the session in 5 minutes. Dear participants, we will begin the session in 5 minutes. The quest for knowledge begins when you start questioning like a child. Honorable guest Dr. Murthy Ramila, esteemed dignitaries, mentors, dear delegates, and all my dear team members. Good evening and warm welcome to the last session of this technical extravaganza, SYNAPSIS 21, a 4-day national webinar series streamlining the digitalization in healthcare amid pandemic organized by Department of Biomedical Engineering. Please, IEEE EMBS SBC TKMIT, IEEE SB of TKMIT in Alliance with IEEE EMBS Kerala Chapter Students Activities, Telemedicine Society of India, Kerala Chapter and Digital India Health Association. We are deeply contented to see such an active and interactive participation from everyone, and thank you for joining with us on all 4 days. As we reach the end of the series today, we have our most dignified speaker, Dr. Murthy Ramila, speaking on evolution and growth of telemedicine in India. To give a detailed introduction of the speaker, I gladly welcome Mr. Assistant Professor, Department of Biomedical Engineering.
Thank you, Sandy. Good evening, all. Dr. Murthy Ramila is an energetic and enterprising individual with a diverse career graph spanning 27 years of rich cross-functional experience covering the technical, business, and managerial domains. He has a seasoned professional with experience in the areas of program and project management, business analysis, and leadership role in international marketing of high-tech product and service with exposure to HR, finance, and administration. He is the head of project management, the Human Space Program of India, Gaganyaan ISRO. He was the head of supply chain management, ISRO Satellite Center, Bangalore during 2017 to 19. Dr. Murthy worked as Deputy Project Director, XPO Satellite Project Company for a span of 4 years until 2019. He joined Indian Remote Sensing Satellite Program Management Office and worked for project management of National Database for Emergency Management, a project of Ministry of Home Affairs, Government of India carried out by ISRO. It is a great pleasure to welcome such a nationally accepted personality as our guest of honor in SYNAPSIS 21. Welcome you, sir, on the behalf of one and all present here. Over to you, sir.
Good evening. Good evening. Thank you for the nice words, Professor. And welcome once again to the last session of this conference or the event. Before I get into the presentation, can I know, madam, how many are the continuous or repeating participants from day one out of this 83 approximately percentage? Madam?
Sir, it is 45%.
45%?
Yes, sir.
So precise. Okay. Now, why I asked is because this topic is introduction to telemedicine. It should be in the beginning and not because of my greatness by the topic, but then it is in the last. So I don't want to repeat the known things. So let me see and just tell me wherever things are already covered. Okay.
Oh, sure, sir. You may continue.
Yeah. You are able to see this?
Yes, sir.
Presentation?
Yes, sir. It's clear.
Yeah. Yeah. So in addition to the my roles and responsibilities in ISRO, I am also the honorary secretary for the Telemedicine Society of India since 2019. So that is the Telemedicine Society, which is promoting the telemedicine activities in India since 20 years. So just this, before the telemedicine talk, I want to quote these two Indian systems quotes. That is Loka Samasta Sukhino Bhavantu and Arogyam Mahabhagyam. Why I am telling is, these two things, though they are there for so many centuries or hundreds of centuries, we have not realized the value of these quotations earlier, before the COVID. Now, what with the COVID, what we are thinking, let all the worlds be happy, not only myself and my family, but all my neighbors, my state, country, and all countries should be happy. Then only I can go out. Then health is the biggest wealth. So now today in the COVID period, we have seen everybody from the common man on the road to Ambanis and Adanis, everybody is equally affected, maybe slightly more or less, but in their activities or business and everything. So the money, amount of money or the wealth you are having is not coming into comparison with the health of you and the society. So these two things are there for many centuries, but now they are getting the relevance in the time of the COVID. So we know that health means generally it is not disease management. It is a maintenance of the health, that is lack of disease, but well-being in all three dimensions, that is physically, mentally, and social aspects. That is the true health definition as per the Indians. And so these three steps involve healthcare in prevention, maintenance, and management. So that is that is self-explanatory. And the good part is the telemedicine is useful in all the three phases of this health management, that is prevention, maintenance, and management. So in the Indian system, the origin of telemedicine is through the ISRO's satellite communication based telemedicine in the year 2001. That is my previous speaker, Mr. Farooq, has covered how we have provided the satellite based connectivity in Jammu Kashmir and the hilly regions. So the patient end and the specialist end, that is the expert doctor's end, will have a VSAT terminal, and that is connected to the computer and other peripheral devices or the medical diagnostic devices at the patient end, and the doctor end will have mostly the monitoring purpose, and all the both the ends connected by the video conferencing system. And how ISRO has started as a technology demonstration, because though ISRO is not involved in the healthcare management, we have seen that there are doctors on one end, there are patients on other end, and technology is there on the other end. So what we have done is a marriage of all the three, that is connecting the doctors and the patients with the technology. That is how ISRO has taken up this technology demonstration project called telemedicine. So initially it was started in a point-to-point system, that is one doctor or one patient talking to each other. Afterwards, it has gone into one point to multi-point, so that one end doctor can talk to multiple patients, or one patient can talk to multiple doctors, and ultimately multi-point to multi-point. So multiple patients and multiple doctors, they are all in a grid, and they can always select whom they want to talk to, and they can talk to the respective or desired doctor. So what happened with this ISRO's initiative that has got good attraction? So more partners have joined. That is the SRMC Chennai, Apollo Hospitals, SGPGI, and Lucknow, and PGI Chandigarh, Narayan Hrudayalaya. Like this, so many other well-known hospitals, they have joined this telemedicine program. And though it started with the ISRO's satellite-based connectivity in the beginning, it has adapted to more applications, more technologies for connectivity, that is like the internet, broadband, wireless, and statewide wide area networks in some states, fiber net or grid in some states. So now today we are having more of the mobile connectivity also. So whatever is the technology, more partners came, more technologies came, so the dependence on ISRO has been reduced. And though it was initially started and more popular for cardiology, subsequently other specialties in medical field like diabetics, ophthalmology, dermatology, they are all joined. They all have seen the benefit of the telemedicine and use of telemedicine for their line of treatment. So everybody has joined. That is how the telemedicine has grown in India. And ISRO, what they have done, as I said earlier, we have provided a satellite based connectivity with a dish antenna at the doctor end and patient end. But there are many villages in India where they don't have a permanent doctor, and some of the specialties like the ophthalmology, they cannot open up a ophthalmology or a eye specialist hospital in all the villages. So two great institutions, Shankar Nethralaya and Arvind Eye Hospital, they have come up with a model of this mobile van or a mobile bus based satellite based connectivity. So all the equipment for the ophthalmology, eye testing, and even making the eyeglasses and providing then and there, they were all built into this bus. And this bus was going from village to village in a campaign mode. And then they were camping near the school or a private hospital or a panchayati office for 2 days, and then they were providing the medical consultation. So most of the people, they were getting the consultation then and there and treatment there, or some of the cases where they are required to go to the specialist hospital, they were advising you go to a bigger hospital. In India, we have the bad luck even today in 2021 is many of the people beyond 40 years, they don't know whether they have a diabetes or not. Generally the eyesight will be reduced, the eye power will be reduced, and they will think that okay, this is 40 plus regular symptom. And when it is very bad, they go to a doctor, and the doctor asks them, do you have a diabetes? No sir, what is diabetes? I didn't know, I didn't get any testing done. Then they go, and then that is already in a high level. So because we don't have a preventive or a annual checkup in our Indian system. So what happened with this the regular screening of the patients through Shankar Nethralaya, Arvind Eye Hospital, and later through some other hospitals also, many of the unknown diabetics patients, they have come out, and then they have started the treatment for some people in the late stage, but some people in the early stage. So that has really helped India in preventing a widespread blindness disease through the diabetes, that is called diabetic retinopathy. So that is how the growth has happened through internet and other technologies, ISRO and fixed nodes and mobile vans. So whatever is the modern technology, ultimately the growth of telemedicine in India has been witnessed. How through, though it is known by different names, by telemedicine, sometimes some people call it as e-health, m-health, that is a mobile phone based healthcare system, or telemonitoring, whatever is the name, overall message is it is increasing in popularity, more number of patients are requiring, more number of doctors are providing, and more number of technology companies are coming up with their apparatus or devices or software applications. And thanks to COVID, whatever we as a telemedicine society or the telemedicine practitioners could not do in the last 20 years, that was done, or more than that is done in the last 1 year because of the COVID. So that way we should thank COVID for popularizing the telemedicine. Like all online things have started now, right? Right from LKG, they are giving online classes. So online lectures, online games, everything has started. Now in that process, telemedicine also has become more popular with an online availability of the doctors and patients willing to take the online consultation. So the bottom graph shows that there is a global telemedicine market which is growing. Don't bother about the numbers. What it shows is the market is increasing. So what this market is comprising? Market comprises the telemedicine devices, telemedicine computers and other hardware, and telemedicine softwares, and telemedicine consultation fees, and the telemedicine connectivity options. That is the mobile phones or mobile connectivity or the other wide band area or the internet connectivity, whatever it is. So all these areas are getting benefited, and in turn they are benefiting the doctors as well as the patients. So Telemedicine Society of India, as I have told, is a scientific non-profit organization, a scientific society where we have membership from doctors, technology people, scientists, engineers, academics, and hospital administrators. and some NGOs also. I am also a doctor by PhD, not a medical doctor, and I am a technologist basically in ISRO. But what I have told earlier is we have done a combination of the patients, doctors, and the technology. That is how the telemedicine has grown. And this society, Telemedicine Society of India, has done the marketing, promotion of this telemedicine program or a project through annual conferences, regional workshops, and meetings, etc. So we have done this practice for last 20 years, and we have been approaching the government of India for more than 10 years to make it legal and regularized. And that has happened in the last year with the issue of the guidelines and recognition. And we have formed several working groups for increasing the usage of telemedicine in India. And we have trained more than 6,000 doctors in the last 1 year. And first 2 months, last year, April and May itself has seen almost 4,000 doctors getting trained in the telemedicine activities, because earlier many people know about telemedicine and many people are not aware of the telemedicine also. But some people, though they know the telemedicine, they were not practicing for fear. And some patients also, though they were knowing about telemedicine, they were not taking or accepting telemedicine because they are not very sure how effective or how good it is. So now this COVID has changed the scenario. Patients are coming, doctors are providing service, and more opportunities are available for the business, and more options are there for the doctors as well as the patients. And what we are doing from the Telemedicine Society is we are working towards training more number of doctors and the students, so that today's medical students and other technology students are the leaders of the next generation. So they can be providers of the technology, like most of you are engineering students, so you can be providers. I will deal that later. Or as a medical students, you can be the practitioners of telemedicine. And this is the conference in Telemedicon 2018 held in Amaravati, with the active participation and involvement of the government of India. And we were fortunate enough to get Dr. Vinod Paul as the chief guest for the valedictory function, where we have told that, sir, these are all the benefits, these are all the sessions held. We have been declaring and talking about the usefulness of telemedicine, but somehow it has not got the recognition from the health ministry, because whatever ISRO talks or students talk or medical students talk is not great value compared to the recognition and promotion by the Ministry of Health. So that he has pursued with the government of India, and later we have got the telemedicine practice guidelines in 2020. So this is what I have told. What is that actually, why the telemedicine practice guidelines are issued? That is to see that telemedicine consultations, they don't remain to a specific small set of people or small set of the leaders who are promoting and providing the telemedicine services, but to bring them to the mainstream of healthcare services. Because the brick and mortar, whatever we call as the physical hospitals, you cannot build in all the villages across India. We all know the conditions in village. And the doctor, even if you build with so much of money also, you cannot retain the doctors by posting them in the villages, because the doctor's family also wants English medium convents and multiplex theaters and his facilities. So they also cannot be retained in the villages. So what is the best way is to bring and build infrastructure, that is information based healthcare delivery structure, to replace, at least wherever possible, the infrastructure that is the normal physical hospitals based structure. It is not to say that we don't need doctors in the villages. Definitely they are required, but we cannot provide, even if you give the total government of India budget to health also, we cannot make the doctors stay in all the remote villages and corners of the India. So this information structure based telemedicine should be complementing and in some cases supplementing the infrastructure based telemedicine, infrastructure based regular medicine services. So we have to use the digital tools for the delivery of healthcare to all the people across India, because India is one particular country with large population, and not only large population, we are spread across hills, islands, and then very distant areas, and then in the cities, villages, all kinds of human spread is there. So we have to meet all these demands, means we have to get into the telemedicine, recognizing the benefits, availability and use of telemedicine. Government of India has recognized the telemedicine as a real tool, and then designed the guidelines and issued them. So with that, what happened? The practical advice to doctors. Suppose there is a rural doctor in a village. So he needs some advice from a senior doctor or a tertiary doctor specialist in case of some difficult cases. And even healthcare workers like the ASHA workers or pediatrics, no, not pediatrics, uh, the other semi-skilled medical people, when they are there, they have also to be trained to see that they provide the necessary health care to the doctors, to the patients. So in these conditions, these telemedicine practice guidelines will help providing based on the current information, available resources and patient needs, to see that the patient and provider both are healthy, happy and safe. Because there are some difficulties, though there is an ease and convenience in digital healthcare, there are some difficulties also. So the telemedicine practice guidelines have seen that this is, I will not get into the micro details of practice guidelines, but what I will say is these guidelines generally start from the definition of telemedicine, what is telehealth, and who is a registered medical practitioners, what are the hardware and software to be used, how the doctors have to get certified, and what are the ethical norms and standards to be followed both by the doctors as well as the patients, and what are the tools, etc. And then what are the medicines to be prescribed, or what are the medicines which cannot be prescribed, because in case of the psychiatric conditions and others, there are high level of sedatives and other medicines which are prohibited to be prescribed in an easy manner. So they have to really test the patient and give. So these telemedicine practice guidelines classify those medicines, and how the records have to be maintained, and how do you maintain, most importantly, the privacy and confidentiality of the records of the patient. Because suppose some patient is known to have some cancer, and if that information goes out in a wrong way to wrong hands, 10 people, 10 companies will contact that patient saying that we have so and so medicine for cancer cure, or we have so and so diagnostic test for cancer, please come to us, like that. So the patient should not be disturbed with that leakage of information. Today we are seeing this problem by the banks and other credit card companies and others, simply getting our mobile number and disturbing each and everybody, right? So same thing should not happen, and particularly in case of healthcare, that is more dangerous and more troubling. So the patient's privacy and confidentiality is to be maintained and protected, as well as the safety of the doctors also to be done. So basically these telemedicine guidelines, they cover four kinds of consultations, but that is between a patient to a doctor, or a caregiver, for in case of the minors or very senior people or some lunatic people, the caregiver can talk to a doctor, or one doctor can talk to another doctor, that is a local doctor talking to a specialist doctor for a higher level of consultation, or healthcare worker like the ASHA workers and paramedics talking to a doctor and providing the local consultation. These are all the four things. So this I will skip it. So finally, what is happening? Last 20 years, we have seen that there is a technology or industry push. We have been telling that there is a technology, there is a possibility, please use it, please use it. That is one thing. But now this COVID-19 and telemedicine practice guidelines both have helped that this push from the technology or industry has become a consumer. Who is the consumer in this case? That is the patient. So the patients are pulling, I want a telemedicine consultation, I want my home-based consultation. How do I do? What is the technology? What is the best way? Like that they are asking. So this COVID and telemedicine practice guidelines have helped in achieving that things. And this I will skip again. Telemedicine has been useful definitely very much in the COVID times, where many video visits and the local in-person physical visits to the doctors are avoided, and many patients have got the consultation in the video mode of right on their mobile phone. And the risk for the doctors as well as the patients, because in a COVID period, we all very well know a patient goes to a doctor for a consultation, he may be saying that okay, there is nothing problem, this is not a COVID, but unfortunately he may get infected with COVID because of the visit. Or the doctor seeing 40-50 people in the day may get contracted with the COVID from one of the patients if sufficient care is not taken. So all those things were avoided, and definitely we have a study which shows that telemedicine was very much useful in the period of COVID. So this I should not tell you no after so much of lectures. And in the last lecture, this is because, but I am showing this for the engineering students to know that telemedicine is a combination of the communication technology, electronics technology, information technology for the benefit of the medicine and application. So all put together, they have got a benefit. 1 minute, please. Hello? Yeah. Namaste. Call me after 1 hour, please. Yeah. 1 hour tarvata cheyandi. I am in a meeting. Thank you. Sorry. So what is the greatest thing which is helping is the convergence. That is the merging of these technologies, because communication is not new. We have telemedicine, telephones and internet for a long time. Electronics is there. Information technology, India is a leader in information technology to the world. And medicine and applications definitely are not new. We have them right from the time of Charaka and Susruta. But the combination of all these things is the real telemedicine, which is bringing benefits to all of the people. So now from the engineering students point of view, I will cover 4 slides. That is, in the communication, what is happening in the field of communication? We are seeing variety of connectivity options are coming, bandwidth is increasing, and the speed is increasing, the latency is decreasing. And then space-based services like the VSAT I have told, and we have got more number of land-based and wireless services also are coming. And we have seen 3G, 4G, and we are now on the verge of getting 5G across India. So though it may take time and spreading across India, at least it is already spreading and it is starting. So we have seen the IoT and other communication things. And what we have seen is more than these individual technologies, the combination, that is the collaboration happening between different technologies is really progressing very well. And that should help the ECE students, engineering and communication engineering students, to help communication, and as well as telecom also is there as a specialization in some colleges or universities. So these students may become tomorrow some employees or scientists in ISRO, or they may become employees in a private company, technology company, or you yourself may set up a technology company. So you have to see what are the technologies developing in communication, how they can be suitable, how they can be applied for telemedicine, and how that can benefit your business as well as providing services to the patients. And we have seen this 5G, most of you must have heard. 5G is starting currently, and it is increasing the spread in India, and very beautiful network. And once this comes, you don't have any higher latency period, and then capacity will increase. So the communication can happen in a better, faster and higher quality mode. So with that, the teleconsultations will be in a higher quality environment. And the next is the Internet of Things. We know the Internet of Things, most of the ECE students again may be aware. So there are so many devices or some small equipment located in a hospital or in a home or in a factory, but everything, though it is working individually, that will communicate with a centralized server either located there or over a cloud, and then sharing the information. So these all the networks, all the equipment connected over the internet, they provide a big picture. Suppose in the Europe, though it is not much spread in India, in Europe and Western world, where the adult or the senior citizens percentage is more, they have more money, but children don't take care much. Unfortunately, India also is getting spoiled, but there they have got money, they can buy so many equipment. So what they have done, many of the homes have become a digital homes. They have so many monitors and sensors across their home, and many senior citizen, they fall, they witness the fall in the bathroom, so they have a fall sensors. So if somebody is falling there, a message will go to their family member or to their medical attendant. So, and whether they have picked up the medicines that day or not, what happens since morning he has not picked up the medicine, the signal goes whether he is well or he is having any problem or whether medicines are not there. All these things can be remotely monitored, and then a digital house. Slowly digital houses will become digital cities, and digital cities will become a digital world. So this IoT and the communication technologies, they help in providing good care and health care availability to all the people, irrespective of their location, wherever they are, whether they are on a hill station or in an island or in a seashore. Everybody can be provided health care or at least health advisory. Though he may not get immediately medicines, at least what to do, what not to do will be known. Then how to reach the medicines to him, how to reach a real physical or a personal service to him is the second step. First step is advice. Now the advice and diagnostics can be done. And now the second field, again for the engineering students, I am stressing is the electronics. Most of us have seen the nanotechnology and miniaturization which is happening, and then our mobile phones are the best example of the development of electronics, how the electronics size is decreasing but their performance is increasing tenfold. Initially we had got very heavy mobile phones with very limited capacity and maybe few MB of the storage. Later it has become built-in camera. Now the camera is becoming one megabits, then 2 megabits, 40, 20, 60. There is no end to that. The companies are building more higher capacity mobile phones, and the patients or the customers are demanding much more. So the loop is never ending. It is going in a loop, like we are demanding more and they are providing more. They are providing more 20 megabit bits, and then we are asking 1 GB. Then they are providing a 20 megapixels camera. No, 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 I need a 30 megapixel. By the time they come with 30, we are asking 40 megapixel. So that is like a dil mange more. People are asking more and more. With that, what happened? More and more electronics are coming, and with more number of companies and participants, the price is coming down. We have seen in the mobiles also how the competition is decreasing the prices, increasing the specifications. And we have got wearable devices. Most of us are aware today our mobile phone itself monitors our heart rate, our walking distance, our speed, our sleeping time and anything. And some of the wearable devices have come to monitor the ECG or the diabetic patient's condition with the specific parameters, and those signals, if that is crossing a limit, will go again to the medical attendant or their family doctor or the son or daughter, whoever is the attendant. So these electronics developments, again, my request to the engineering students is, don't just study for the sake of your exams. See what is the overall picture, what is the electronics growth or advancements happening in electronics field. Then what are the implantables? We have seen some of the small devices, chip level devices implanted within the body, so that they monitor, and they will also automatically inject the insulin based on the diabetic reading which is there. So that is another one of the implantable devices. Like that, so many technologies are coming. So the engineering student should keep an eye on what are the requirements. For that requirements, you don't have to go to the internet. You can see in the society, in your family, your father, mother, grandmother, grandfather, or your relatives in the villages, what are they lacking, what are they looking for. That is the requirement. Then what is happening across the globe, what is the technology growth in America, Europe, India, what are the devices we can make, or what are the devices we have to import, etc. And then what are the smartphones applications being happening. Now today you see smartphone has become a phone, camera, watch, and then your health monitoring, health parameter monitoring device, pedometer, everything. It is becoming a all in one, and it is replacing your computer also. So now, as the smartphones are becoming more smarter, how do we use them for more number of applications? You don't have to design a smartphone, but you can design a good app to use the smartphone for something which you see in the society, or in your family, or in your grandparents. And then how do we build the robotics for the benefit of the patients through telemedicine? How telesurgeries can be done? And then what are the fears? What are the fear factors? How do we eliminate, or how do we give more assurance to the patient when he is going through a robotic surgery? Then multifunction test units. Today they are coming. Last week only there was one beautiful demonstration of a small device where actually the patients can insert their finger, and then the diabetic readings, the random blood sugar, then the glucose level, then the blood level, and 5-6 parameters like that are getting into the digital system. So they are automatically immediately recorded. The message goes to the server where it is maintained, and the message goes as a message to the mobile phone of the patient or his caretaker also. So what is happening? Multiple functions, multifunction test units are coming. So one unit is meeting the requirements for multiple tests, and so with more number of tests being conducted through one unit, the price of the units is coming down, and the patients are happy, and their relatives or children are more happy. So with this, what happens with the miniaturization of the electronics? These are all the examples you can see. Are you able to see the devices?
Yes,
Hello?
sir.
Yeah.
Yes, sir,
So
we
these
can
are
see.
all the devices you see. They're like a small mobile phone sized ECG machine. Now today we have got much more advanced ECG machines with almost as small as a credit card. So more number of wearable devices are coming. And in the COVID period, we have seen this digital oximeters, pulse oximeters. So more number of devices are coming. Again, my submission and suggestion to the engineering students, particularly the electronics, IT, and communication people is, don't just confine yourself to the exam or syllabus or the curriculum and unit test or midterm test. See the big picture. What is happening across the globe? What are the requirements? How can we devise a new device? How can we design a new device? Or how can we increase the application of an existing device? Or how can we reduce the size of a device? How can we reduce the cost of a device? It is better if you reduce the size and cost also. So these are all the challenges as well as opportunities for the engineering students in the media, in the communication and telecommunication and electronics. Now coming to the information technology, we have seen that computing power is increasing day by day. Big data and IoT, we have seen they are coming into picture, and cloud computing is now a household name. Everybody knows that. Artificial intelligence is coming, machine learning is coming. Like this, all these things are happening, and most of you as engineering students are also attending these courses in addition to your regular college or university courses. But again, here what you have to see is what is that behind these technologies. How do I put them into application? You are getting good marks and getting a good percentile or score is one thing, but how do you bring it into application for helping the real people at the villages or people in the need? So either you bring down the cost, that is good as we have seen, or you communicate this information of the patient, as we have seen the patient's confidentiality and other things. You build more number of protection mechanisms, security layers, and deliver this information from point A to point B in a more secure way, so that it is not hacked or it is not going into the wrong hands. And then how do we develop more shared networks? And then how do you do the database management? Though we are talking today, it is not there, but tomorrow, let us say like Aadhaar, all the patient's information of Aadhaar linked health information is there across the India in a healthcare grid. And then you go to a doctor, the doctor has to get your information. That time you just wait and then enter the patient's Aadhaar number. It cannot wait for half an hour to get the data. So it has to quickly get the data of the patient, what are all his symptoms, what are the previous tests done, and so that you don't have to carry a physical file. So how do we do the database management? How do we do the data retrieval? And how do we do the data mining? All these aspects in the information technology have got an integrated relation with the technology developments in communication and electronics. So all these three people together, if they work, again, these three people together, they have to work in collaboration with the medical people. Again, these four people together should work in collaboration, understanding the requirements of the people. Best example for the people, I am repeating for the sake of confirmation, is talk to the your grandparents or relatives or just as people in the villages. What are their troubles? What are the difficulties they are facing? With your education, with your what is that? Connectivity option or the electronics or any of the technology, how can you decrease their troubles? You don't have to do a free service all the time. You can do a business also, nothing wrong, reasonable priced business that will help your company as a business, that will help them as a patient or as a customer. So all these things have to be incorporated, and that's why I'm insisting once again, all the engineering students, you should go to the library, or nowadays online libraries are there. You should go see the developments, read more number of journals, read more number of papers, what is happening in electronics, what is happening in database, what is happening in virtual reality for remote training. How can we train more number of doctors, or more, let us say the nurses are there. How can we train 1,000 nurses in 1 hour lecture? How, without taking the specialist to 20 hospitals? So all these things can be implemented with the application. My stressing is today from the engineering students point of view for the application of the technology. And this is being from ISRO, I will say that the use of satellite technologies can be used in the first slide what I told, that is in the preparation, monitoring, management and correction. For that we have got different satellites, that is weather satellites, remote sensing satellites, communication satellites and the navigation satellites. So how can we use all the satellite technology? How can we connect all the hospitals? How can we connect all the remote patient ends? How can we connect all the mobile vans? And then how do we provide the service? Let us say a patient is there, immediately you have to go to a specialist. Orthopedic accident happened and you need a orthopedic doctor. So what is the nearest orthopedic doctor? Then what is the best route for that day, which hospital is available? Or a bigger accident happens, 50 people are injured, out of that 30 people need treatment or a initial injury treatment, or 20 people need orthopedic. So what are the hospitals with the 20 beds? So all these information can be provided through the database management, and the navigation satellites, which will help in taking the patient to the right hospital without wasting of time. And the golden hour, particularly in case of cardiology, they say golden hour. So in the first 1 hour, if the patient is taken, they can be given a better treatment. Today you see the satellite data applications for health management. All these different colors you are seeing, they all represent different kinds of diseases. What are the vector borne diseases? Then what are the animal alerts? Some animals we know they spread, they are the originators and the spreaders for the diseases. And some are the respiratory alerts. Today we have seen COVID, but you see in this 114 respiratory alerts are there. So tuberculosis, whooping cough, then pneumonia, influenza, H1N1, all these things we have forgotten now with the COVID. But these are all the younger brothers and younger sisters of COVID before the COVID came. But this much pandemic was not there, so we have not witnessed. But you see here, all the healthcare information can be captured and then put representatively on the map, so that the health administration people, this may not be required for a patient or for a particular doctor, but for the district collector, for the state government, for the central government, this information should be known. How many hospitals are there in that district? What type of diseases are there? What type of patients are there? How do we take them? All this information has to be there. So all these things will be useful through the telemedicine. But then, oh, you are telling everything is so great, technology is increasing, ISRO is helping, and doctors are increasing. But is everything rosy? Still no, because we have got so much of challenges and difficulties in the widespread usage of telemedicine, because changing patient and physician needs, you provide some things and the patient says no, this is okay sir, but probably if that additional facility is there, it will be more happy. Or you should be, or software, as a software company, I may develop a beautiful, I may develop an application and say that my application is beautiful. But then the patient may not feel it comfortable, or the users may feel that it is not user friendly. So we have to understand the user requirements. Then some of the systems, they will become obsolete by the time you come up with a product. The technology or particular chip will not be available. So you have to do a redesigning. And in some cases, maintenance becomes more difficult and costlier than purchasing an equipment. So how do we overcome these difficulties? Then privacy and security we have seen, that is the information, particularly like the banking information, the patient's information is to be protected for privacy and security. And then so you have to take care of the information systems, security systems, to take care of all these difficulties and challenges. And all these things are okay achieved, let us say in the next 5 years everything is done. But then what about the user acceptance? He will say, sir, very good sir, you have given a very good camera, very good system, this is there, that is there, but parallelly I want to connect to two systems, or instantly I want to do this, or you are advising everything sir, but I am not getting a medicine. So what is the use of this telemedicine? Like the different challenges, they will come. So we have to do everyday research. There is no end to this research. In this telemedicine, suppose ISRO we have started 20 years back, but so after that so many companies, hospitals, administrations, and everybody has joined, and everybody is trying their own level best to see how the technology is developed and how it is better used, and how more number of people are aware of this technology. So how for, as an engineering students, again the right side box is applying to the engineering students as challenges, which are equally useful to you as opportunities. Data encryption, secure connections, then how do you provide a multi-tier authentication, then how do you fill the gaps in the mobile telemedicine, so how do you provide a data storage and retrieval, which we have seen. So all these things are challenges which are equally good for the companies and the students as opportunities. So finally, what is the thing? People are important. Technology is important. But then again, people and technology alone is not sufficient. The both have to merge together. Even if the technology is there, if the people don't accept the technology, there is no use. And even if the people are crying and craving for technology, if the technology is not suitably developed, there is no technology which is meeting the requirements of the patients. So what is required? We need the right technology to the right people at the right time to get the maximum benefits of the telemedicine. Suppose you say that I have got a great telemedicine system, it will cost 25 lakhs, you establish in each village. Over, that is not possible. Or I have got a great technology which is there only in America or somewhere in France, which is not available to us, no use. Or I have got another great technology but very difficult, you need somebody to be trained for 1 year, no use. So what we need is the right technology, whatever is available in our budget, in our country, and then to the right people, that is to the people in our villages who may be skilled or maybe semi-skilled or unskilled people. And then everything is possible, sir, but the heart attack comes at morning 11 o'clock and you provide the consultation at night 11 o'clock. What is the use? So it should go at the right time. So right technology to the right people at the right time. That is the essence for the success of the telemedicine. Then it will get the public trust and everybody will take that as a help. So today we see who is driving the telemedicine. Earlier, definitely I can say ISRO and other technology companies, we were driving the telemedicine, and Telemedicine Society of India was pushing the application. But who are all the players basically in telemedicine? The patient, technology, and the doctor. So each one is important and each will be driving the other, and then the feedback is to be taken and the new technology or new application or the new process is to be developed. So we need the technology revolution on one side to increase the technology, and behavioral revolution. Because in a hospital, if all the technologies are there and if good doctors are there, but if patients are not coming, what is the use? And if patients are there but no technology, so it is a right combination which is required to develop the technology and also for the utilization and behavior of the people. Operator, patients are asking, doctor is ready, machines are there, but operator is on leave on that day, telemedicine room is locked, so what is the use? So behavior is important for the driving of the technology for the benefits of the doctors, patients, as well as the companies who are providing the technologies. Ultimately, again, the engineering students, you may not be ready to directly develop this or design this, but you all should dream that we have a ultimate dream of telemedicine grid in India. How do we connect so many health and wellness centers? How do we connect all the doctors? So today with the mobile number portability and one India, one mobile number, today we are seeing the communication revolution has come. With just one mobile, with one uniform rate, we are making calls across India and receiving calls. Same way we should have a healthcare technology and a healthcare grid for a telemedicine grid to see that any patient from anywhere at any time can consult any doctor. Of course, anything to any time, anywhere means again we have got the greatest bad habit of misusing. So again, there should be a system for the rationalization and prioritization of the uses, and how do we connect different operators and different states and medical colleges, NGOs, engineering students, and the research institutions and the mobile vans. Everything should be connected so that we can feel that we have a doctor with the mobile phone and a mobile telemedicine app in our mobile phone. We can see that we always have, we can feel that yes, there is a doctor in my pocket, at least for a first consultation. So that is how we should see and develop towards one country and one healthcare network, so that everybody feels he is healthy, or if not healthy, he is in a healthy hands, he is in safe hands for getting a health care. So now my acknowledgements and special thanks to the organizers of Synapsis 21 for inviting me to this, And sorry, in the last lecture, if I have given again some more things which I have already learned over the last 3-4 days. And to all the doyens of telemedicine in India and individuals, institutions in this mission, because telemedicine is not a ISRO's baby or some Ramchandra Hospital or Apollo Hospital's baby. It is a mission for the growth of India and for the wellness of India. And definitely last but not least is Telemedicine Society of India, where we are providing the service. And through this forum, I request all of you, the doctors, the companies and the students to become members of the Telemedicine Society of India as individual members or as student members or pediatric members or as a startup member or as a corporate member. Different memberships are there. Please log into the Telemedicine Society of India TSI website, see the membership, join, help us, and let us grow together. Thank you. I hope I am in time. Yeah.
Thank you, sir, for that outstanding session. It was indeed our pleasure to have you with us for our final session. Now, with your permission, moving into the question and answer section.
Yeah.
I request all the participants to kindly post their queries in chat box.
Yeah, please.
Sir, shall I read out for you?
Yeah, please.
Okay, thank you. The first question from Jacob Varghese. The question is, what are the different pilot projects ISRO integrated with telemedicine with resource information database at village resource center to reach out to the rural areas of the country?
Yeah. ISRO has developed the telemedicine-based pilot networks in the states of Karnataka, Rajasthan, Maharashtra, Madhya Pradesh, Andhra Pradesh, and Jammu Kashmir, and so many states. And in some states, we have also developed these village resource centers called VRC, which are not simply limited to telemedicine alone, but they are useful as a remote sensing based information for the farmers. And in the afternoon time, it is useful as a healthcare preventive steps for the housewives. And then the telemedicine centers or telemedicine services are integrated into that, and sometimes they are provided for the entertainment purpose also. So these village resource centers were there again in Karnataka, Maharashtra, and in Rajasthan, and in some states. But again, all these things are the pilot projects. ISRO itself cannot establish so many centers and run and operate and maintain. We have done these things as a technology demonstrators. So the concerned health ministry or the local ministries of the state governments, if they come forward and if they develop these multiple centers as a multi-purpose centers. Earlier we used to have STD ISD booths, and later Xerox was also integrated there. After that, we have seen the internet centers where they are allowing you to provide internet surfing or printing and other scanning technology. Like that, we should have the multi-purpose centers run by the state governments and the NGOs. ISRO has done these developmental projects and demonstration projects, and we can provide the guidance and the help in establishing them and running them. Hope I answered the question, Mr. Jacob.
Thank you, sir.
Yeah.
Moving on to next question. It's from Amina. How is telemedicine monitoring node used for testing and supporting users in ISRO?
Monitoring node means actually we get the usage of the I don't know exactly if I understood correctly the question. One is usage of the bandwidth provided by ISRO satellite. Second is usage of the facilities or the telemedicine centers provided by ISRO. First one, usage of the bandwidth, we know which user is using for what duration and what data rate was provided and how much data consumption happened, like our mobile data consumption. Second one is how many centers we have established, how many consultations they have provided. We were asking the quarterly reports. Of course, again, some hospitals and some states were good. they were good users and good providers of data. Some hospitals were using, but they were not providing data. And some hospitals and some states were not using and not providing the data. But then in that particular case, unless they provide, we don't know. Suppose we can see that this hospital in Chamarajanagar is connected to Mangalore hospital for 25 minutes. Another hospital in Kollam is connected to Bangalore hospital for 45 minutes. But what consultation he has done, how many patients he has seen, are they cardiac patients, are they diabetic patients? That information has to come from the local systems, or some cases where we are reading the database also in some pilot cases, we have analyzed from the information. But again, the problem is ISRO cannot get into their information system and read the database to know how many patients or how many diabetic or how many ophthalmology. Again, as we discussed, that is a patient privacy. So the answer to the question is, we have used the normal electronics monitoring purpose, which we have got the system for the monitoring of the bandwidth utilization, and for the utilization of the systems, we depended on the reports from the doctors or the hospitals.
Thank you, sir. The next question is from Rituja.
Yeah, your voice is breaking.
Biomedical engineers, what kind of technology should be budding biomedical engineers work in order to enter in space technology and manned missions?
Can you repeat?
Yes, sir. When will ISRO recruit biomedical engineers, and what kind of technology should be the budding biomedical engineers work in order to enter in the space technology and manned missions?
Yeah. Your question itself is having the answer, because the manned missions, as right now I am in the manned mission Gaganyaan project. Okay, but then what is happening in this Gaganyaan project? I am not the project head for the whole project. Each center, the ISRO Satellite Center, VSSC Trivandrum, and Space Application Center Ahmedabad, and Sri-Harikota, everybody has got their contribution. Like any rocket or like any satellite, in the manned mission also we have got different deliverables, roles, and responsibilities from different centers. I am heading the project management from my center, that is the URSC, UR Rao Satellite Center. So from our center, what are the responsibilities? There are two modules, service module and crew module in the space Gaganyaan mission. So in that, for our responsibilities, I am the project head. Now coming to the question, right now we are giving this biomedical monitoring and the healthcare monitoring, etc., to the IAM, that is the Institute of Aerospace Medicine. And then when these manned missions increase more, we ourselves may get into more number of biomedical engineers directly recruited by ISRO and directly serving the manned mission projects. But for now, we are concentrating, ISRO is concentrating on developing the rocket, the module, that is the service module, and the crew module. Crew module is the box where the crew, the astronauts are sitting. Service module is monitoring their health, providing the required ventilation, oxygen, and other biomedical fields to the crew. That is the service module, and the battery levels, the power levels, the voltage, all these things are maintained in the service module. So ISRO for now is focusing on the technology aspects. This biomedical aspects is given to the IAM, and some of the training and the astronaut selection, they are given to the Indian Air Force, and then they are sent to Russia for the astronaut training. So these things are happening in a different modes at this moment. So the answer is biomedical engineers after some time, but definitely in small numbers, will be into ISRO. But because we are taking these services from those people, because why to start the biomedical engineering in ISRO and start from the scratch? There are leaders outside. So we take the services from them.
Thank you, sir.
Thank you.
Again, the question is from Rutuja. It said, how can mechanical engineer graduates can contribute to biomedical engineering field?
Biomedical engineering field, yeah. So whether it is a biomedical engineering field, rocket, or a satellite, or a human space mission, the mechanical engineer's job will be to design the outer shell, whether it is a ECG machine or anything, everything has to sit in a box. So that box is to be designed, and based on the rocket or satellite or a ECG machine sitting on the laboratory or in a hospital, the materials are to be different. So the mechanical plus metallurgy people together will be useful in finding out what is the best suitable material for this. What is, suppose I am talking from the ISRO point of view. So what is the best material for flying the rocket? For the rocket, what are the things? We should have the least weight, maximum strength, least cost. So always there is some rocket design which is there today, but tomorrow the mechanical plus metallurgy engineers can come with a new design which will be giving a better strength or a lesser weight or a lesser cost. Same thing applies in the biomedical field also. How do you provide, how do we know the electronics is decreasing in size? So how do you come up with a optimum box size which will house all these equipments in a optimum and a compact manner without causing any disturbance. Sometimes what happens, the electronics, they will cause disturbance from one unit or one subsystem to the other subsystems. So how do you provide a good real estate for these electronics within that item, within that constraints of the box? So these are all the contributions from the mechanical engineers. I don't know whether that satisfies your student Janiab Fida. Is that good?
Yes, sir. Yes, sir.
Yeah.
So thank you, sir, for answering all the questions raised. I
Thank you.
hope the participants are overwhelmed by this session. It would be great if any one of you could give us the feedback for the session.
Yeah. Thank you. How many students are there at this moment? Are out of 140, how many, 50% are students, or can you give me some statistics? How many are doctors or professors? Approximately.
Good evening, one and all. My name is Namida. I'm a second year BTech student. First of all, I want to thank you, sir, for granting such an informative session, especially about future of telemedicine, IoT, telemedicine enablers. You indeed gave all answers to our doubts, giving us a clear idea about evolution and growth of telemedicine in India. You really did keep us attentive throughout session by making your insights interesting. Thank you so much, sir, and I'm looking forward for getting more opportunities in attending more of your sessions.
Thank you.
Sir, there are around 10 to 15 professors and rest are students.
Okay. Thank you. I see one more question. How can paramedics contribute, implement the telemedicine services? Paramedics, definitely they have a bigger role now with the issue of the telemedicine practice guidelines. Wherever an MBBS doctor is not there in a village, but then somebody is sponsoring or setting up a telemedicine center, a paramedic person can be there. He can work as a bridge between the patient and the doctor in the city, and he can take the advices from the doctor and convey to the patient, and he can take the measurements or diagnostics or monitorings from the patient and convey to the doctor. And suppose if the doctor gives a prescription, he can explain that ideally it should be done by a doctor, RMP. But in case where there is no doctor, this paramedic can do that job of understanding that, explaining to the patient and helping them in taking the medicines in a timely and proper manner.
Thank you, sir. Dear participants, kindly fill the feedback form given in the chat box. I welcome Mr. Rishi Manoj, Technical Team Lead, for delivering the word of thanks.
Thank you, Sandy. Am I audible?
Yes, sir. Yes, Rishi, you are.
Now that session is going, can we ask all the people to switch on the cameras and take a group snap? No, that's not the idea.
Sir, I think we can do it in the end.
Yeah, is it not the end?
Okay.
Okay, go ahead. I will not disturb your schedule.
Okay, good evening all. I am Rishi Manoj, third year biomedical engineering student of TKM Institute of Technology. It gives me immense pleasure to deliver the vote of thanks of the event SYNAPSIS 21 to all the participants. We are very honored to have 150 participants. 150 participants on the final day of the event. Thanks for the enthusiasm shown. Moreover, it's my privilege to thank Dr. Murthy Ramella sir for honoring this event with his presence and insightful talk despite his busy schedule. I also acknowledge you for giving us an excellent coverage on evolution and growth of telemedicine in India. Now, as an expression of our delight and respect, I request our worthy chief guest to accept a virtual memento from our side as we owe you for being a significant part of the session. Shall we have the presentation?
Thank you very much.
Kindly accept the virtual memento we have. Consider this as a representation of our endless gratitude. Now, I would like to thank each and everyone who stood beside us till the end of this day, especially Kirti ma'am for giving us an impressive introduction on the chief guest of our session. My sincere gratitude to IEEE EMBS SBC and IEEE SB TKMIT and collaborators, Telemedicine Society of India and Digital Health India Association, who are the backbone of this symposium. Let me take this opportunity to thank IEEE Kerala section and Mr. Allen, the section ECC, for the immense support being extended to us. I thank Ms. Sandy for her interesting comparing and Amida for sharing feedback on this session. And it would be ungrateful if I end up not acknowledging the wonderful participants. The cooperation, interest you have shown are boundless. Once again, heartfelt gratitude for your participation and willingness. Thank you.
Thank you, Rishi. Once again, I thank all of you for your participation and Dr. Ramila for gracing the occasion with your keynote. Here comes the end of the 4-day symposium. If what you do makes a difference, you have to decide what kind of difference you want to make. Thank you for joining with us to discover the difference. I welcome each one of you to the auspicious validatory function of SYNAPSIS 21, Discover the Different. Handing over to Hannah, this is Sandy signing off. Bye-bye.
Thank you all from my side also. Thanks for the opportunity.
Thank you, Sandy. Today is your opportunity to build the tomorrow you want, says Ken Poiret. Honorable Chief Guest, esteemed speakers of all sessions, Professor Dr. Mohanan Kundumal, Srimati Sudhamani S., Dr. Prem Nair, Mr. Vimal Waklu, Mr. Bijoy MG, Dr. Uma Nambyar, Dr. Sanjay Sood, Mr. Farooq Ahmad Wani, Dr. Murthy Ramla, most respected Principal TKM Institute of Technology, Kollam, Professor Dr. Jose Prakash M., respected Head of Biomedical Department, Professor Dr. Unni C., Adorable Branch Counselor of IEEE SB TKMIT, Assistant Professor Anas A.S., respected Assistant Professor Ashwin Rajvi, Department of Biomedical Engineering, all other dignitaries, my team members, and participants. I wholeheartedly welcome you all to this auspicious valedictory function of SYNAPSIS 21, Discover the Difference. To give a red carpet welcome to everyone assembled here, I welcome Vasuvis Gautam, Chairperson, IEEE ESB TKMIT.
Am I audible?
Yes, you are.
A warm good evening to one and all. It is my pleasure and privilege to welcome you all today on this warm, auspicious evening as we mark an ending to our 4-day National Exuberant Symposium. SYNAPSIS 21, a 4-day national webinar series, is organized by the Department of Biomedical Engineering Association, BLAZE TKMIT, IEEE EMBS SBC TKMIT, in collaboration with IEEE EMBS Kerala Chapter, Telemedicine Society of India Kerala Chapter, and Digital Health India Association. Our webinar series adopted a timely theme, telemedicine and e-health, where 9 illustrious speakers handle sessions based on the given theme. Before my official welcome, on behalf of my team members, I would like to convey my immeasurable joy and acknowledgement to you all for making our webinar series a grand success. Participants around the nation gathered and synchronized with us to listen to each paramount personality who took our sessions. The response we got was amazing, and we believe we were able to bring out our best to you. Now, I deem it as my allied privilege to welcome you all today to our valedictory ceremony. First and foremost, I welcome the president of our function and our supporting pillar, Dr. Unni C, HOD, TKMIT, for bestowing us today. Now, gratifying my welcome to Dr. Mahesh R. Panikar, Vice Chair, IEEE EMBS Kerala Chapter, and Mr. Bijoy MG, Honorable Secretary of Telemedicine Society of India, Kerala Chapter, and Managing Director at Unnao Telemedicine and Healthcare Services Private Limited, who stood through thick and thin throughout our series. I am beyond delighted to welcome you, sir. Now, our tower of strength and backbone, Mr. Ashwin Raj V, Associate Professor, Biomedical Department, TKMIT. I welcome you, sir. Now, Mr. Anas A.S., IEEE SB Counselor of TKMIT, who has been a constant mentor and guide to us. I welcome you, sir. Last but the most prominent of all, our ever-supporting pillar, our faculties, dignitaries, and delegates around the nation. Words are in short of the tremendous support you have given us the past 4 days. The pleasure is all mine to welcome you all today as we gather to bid adieu to our symposium. Cordial welcome to one and all once again.
Thank you, Asu. The scenes for this particular notion were adjusted by a person who is not only a great motivation to all of us, but a visionary, and the person who gave us the belief to bring together this event. He's none other than our Head of Biomedical Department, Dr. Unni C. May I take the pleasure of requesting our respected HOD to deliver the presidential address. Sir, please.
Good evening, dear participants and friends. The 4-day webinar SYNAPSIS 21 is concluding today. The webinar is focused on the telemedicine and e-health program and its implementation strategy. The webinar also discussed the evolution of telemedicine and other technical aspects of telemedicine and e-health, the future scope of telemedicine, considering the prevailing situation that is COVID in India, was also discussed. All the resource persons were delivered highly informative and interesting speeches in the last 4 days. There are more than 500 pan-India registration, participation registration, and moreover, around more than 500 YouTube viewers in the video. I hope all the benefited this webinar. As you know, the program was supported by TKMIT, IEEE EMBS Kerala Chapter, Telemedicine Society of India, and Digital e-health, and with the help of our students and our teachers. Thank you. Jai Hind.
Thank you, sir. Now, to felicitate the occasion, I invite Mahesh R. Panikkar, Vice Chair, IEEE EMBS Kerala Chapter.
Thank you. Hope my voice is audible. So good evening all. It was actually very nice to listen to the last presentation. I wanted to listen to other presentations as well, but unfortunately couldn't happen. But I could see that all the videos are recorded online, and that's really, really beneficial. And I encourage, if somebody else missed out seeing by the last talk, we should actually listen to all the talks and enjoy that as well. So it's an honor for me to represent IEEE Engineering in Medicine and Biology Society Kerala Chapter. So you might know, if you're not aware, IEEE EMBS Society is the largest society around the world for biomedical engineers. And biomedical engineers strictly doesn't mean those who have engineering degree in biomedical engineering. So that's a misconception. So I saw some in the chat message, somebody was asking about mechanical engineers' role in building biomedical products. So if you think most of the biomedical products that we see, even starting from a simple stethoscope that doctors use every day to a complicated MRI machine, you have a lot of mechanical design component there. So this is one society which is actually, I would say that way, which is, even though we are under the umbrella of IEEE, this is one society which actually welcomes mechanical engineers, physicists, science graduates, other than the electrical, electronics, communication graduates, because it is for building good biomedical devices, you need a nice blend of interdisciplinary knowledge. So with that, just want to come to the topic of the validatory function here. So I don't think there is a better time to have emphasis on digital health or telemedicine, particularly the COVID-19 scenario has shown us. So this is the right moment to have such a webinar. So I would like to congratulate the organizers, particularly the Biomedical Engineering Department of TKMIT. So this is definitely something which is a driving force, and hopefully such seminars will become sort of a common trend. And this is one area, particularly telemedicine or telehealth or digital health, or whichever name we want to call, is of prime importance to a country like India, where even majority, I would say 70 to 80% of our population is in rural area, but they are not getting benefited by the sheer expertise of our extremely talented medical fraternity. So digital health or telemedicine is an open, or it's a window where I would say major contribution should come from the electrical engineers, mechanical engineers who are listening to this talk, than the clinicians, because clinicians are already there. We have to pitch in, the engineers have to blend, work with clinicians, and then make this happen. So I'm very happy that talks, webinars in this stress is actually happening, and we should actually encourage this. So when I was going through the list of speakers, and it's so exhaustive, illustrious list of speakers, starting off with Professor Mohan and Srimati Sudhamani, Dr. Prem, Mr. Vimal, Mr. Bijoy, Dr. Uma, Dr. Sanjay, Mr. Farooq, and last but not the least, Dr. Murthy. So there's a lot of experience that brings onto the table. So that's really, really nice to see. Big thanks to all of them taking the time out of the busy schedule and encouraging the youngsters who are listening here. So extremely thankful to all of them. And then of course, I don't want to stretch because it's already dinner time and most of you are waiting for your dinner, and already Monday is around the corner. So just want to end the note briefing about the importance of a society like EMBS. So if you're not a member of EMBS, you might be thinking, what is a big thing about EMBS society? So you can think something like we have the professional networks, which are our social networks like Facebook, Instagram, Twitter, all these things are popular, virtually connecting us. So the idea behind something like an EMBS society or any IEEE society is to bring together the group of people. So this is not like something which you do for a job. It's like volunteering. So once you take the engineering degree, the onus is on us to give back to the society. So EMBS or any other IEEE society is sort of a tool for you to actually give back to the society. So you have to join a society, then work with the society, so engage in the volunteering activities of the society, and through that we can actually give back to the society. So I encourage all of you, if you've not actually taken the membership, to please come. This is way to get connected with the experts in the field. You will get sort of service free, which is not otherwise possible, right? You can't just go and meet somebody who's an expert who has 20 to 30 years of experience in the field to come to you. So this is an opportunity for you to come and join the society and get experienced working with those great people. Okay. So with that, I would like to thank for this opportunity and wish all the best for the organizers, particularly to the students who are listening. You might have got motivated with the significance of telemedicine in India, and highly encourage you to actually work now. You listen to it, now make it to practice. Okay, thank you.
Thank you so much, sir. Next, I welcome Bijoy MG, Secretary, TSI Kerala Chapter, and the Managing Director of UNAB Telemedicine and Healthcare Private Limited to felicitate the occasion.
Good evening, all. I'm audible, right? And respected
Yes,
Dr. Wani sir, and our Murthy sir is there, is the Secretary of the National TSI. Sir, can you just turn on your video camera? Okay. So
yes, sir.
It was. Thank you very much. It was an excellent, well coordinated program, and in fact, it was very timely done the program, and I must thank our co-host IEEE SMP, okay, and all the all the students, staff, and the technical team who worked for this program. So telemedicine is picking up, and I think now it's time for you to involve in it. So more and more, people have to come into telemedicine. So that's it I have to say. It's a late. Time is late. Okay. So thank you very much, and we give all our support for your students. Thank you very much.
Thanks to everybody, and thanks to you, Bijay, also. Congratulations for the Kerala chapter of TSI to coordinate and conduct such a beautiful program. I wish more programs by TSI Kerala and more state chapters following your footsteps.
Thank you so much, sir. Nothing will be achieved without great men, and men are only great if they are determined to do so. Ladies and gentlemen, we are so delighted to have Ashwin Rajvi, Assistant Professor, Department of Biomedical Engineering, for sharing the valedictory message with us.
Yes, good evening all. Am I audible?
Yes, sir, you are audible.
Okay. Respected dignitaries and my dear students, I'm extremely happy and proud that our faculties and students have done a remarkable job in organizing this event, especially the teacher who supported our students throughout. Normally, while coordinating such events, students will develop their leadership skill, communication skill, learning how to work in a team. So overall, all our students well coordinated under Amina, grouped into different committees like invitation, publicity, technical, comparing. See, all did their part in the 100% dedication. So, and also, as I mentioned, all mentioned, like the EMBS Kerala chapter, our IEEE TSI, all had given immense support in this wonderful event. So totally, it was a wonderful, and hope this collaboration can continue. TKM Institute of Technology, Biomedical Engineering Department is very happy to contribute further. Thank you all. Thank you very much.
Thank you,
Now
sir.
over to you. Okay.
Gratitude is a fairest blossom which springs from the soul. Every event is an experience, and events like this are milestones in the journey of life. As we came to the end of the valedictory ceremony, I invite Branch Councillor IEEE ESB TKMIT, Mr. Anis Ayers, to propose vote of thanks.
Am I audible?
Yes, sir.
A very good evening to all. Distinguished guests, head of the department, faculty members, participants, and my dear students. On behalf of TK Institute of Technology and organizing committee, I feel immense pleasure to take this opportunity to propose vote of thanks. First of all, I would like to thank Principal Dr. Jose Prakash, Dean Dr. Suresh, and TKM Trust for giving us full support to conduct this program. Next, I would like to express my sincere gratitude to our guest, Mr. Bijoy MG, Executive Committee Member, Telemedicine Society of India. His support helped me a lot. Thank you, sir. I would like to thank our guest, Dr. Mahesh Panikar, Vice Chair, IEEE EMBS Kerala Chapter, who honored this function with his valuable thoughts. Next, I would like to thank Dr. Nisi, Head of the Department, Biomedical Engineering, for his guidance and support. I would also like to thank Mr. Rashin Raj, Assistant Professor TKMIT, for his valuable comments. We are lucky because we got 9 experts in this area to take these wonderful sessions. All sections are very much informative. Once again, I express my sincere gratitude for their kind effort to handle these sessions. IEEE EMBS Kerala Chapter members gives us full support. Thank you all for your continued support. I also extend my thanks to all participants, faculty members, especially Dr. Nidavi Panikar, and students. It is necessary to mention some of our student members, Ajina, Amina, Vasu, Muhammad Alishan, Rishi Manoj, Nijin Nazar, and student members in content team, technical team, and hosting team. Without your support, we would never be able to put on events like these. I sincerely thank each and everyone wholeheartedly for glorifying this event with your presence. Thank you, everyone.
Thank you so much, sir. The end of the story is the new beginning for many others. On this note, let's conclude this most significant and astonishing event, SYNAPSIS 21, discovered the difference, streamlining the digitalization of healthcare amidst pandemic. On behalf of Department of Biomedical Engineering, BLAZE, IEEE EMBS SBC TKMIT, IEEE SB of TKM Institute of Technology, and our enthusiastic collaborators, IEEE EMBS Kerala Chapter Student Activities, Telemedicine Society of India Kerala Chapter, and Digital Health India Association. We sincerely thank all the dignitaries and delegates being with us all throughout these 4 days. I shower my heartfelt gratitude to all the speakers and to each and every one of Blaze family for their support rendered in the success of this grand 4-day national webinar series, SYNAPSIS 21. Thank you so much, everyone. Until we meet again with another enthralling series exhibiting our legacy, this is goodbye from Team SYNAPSIS 21. Good night and stay safe. It's me, Hannah Anzar, signing off. Kindly note, SYNAPSIS 21 is officially closed.